Good morning. Good morning, all. Hi.
Good morning.
Good morning, everyone. We are waiting for some more to join.
Mm-hmm.
I think that's okay for you. Hello. Hi.
Hi all.
So I think we some of the students are joining now.
Yes.
Good morning, everyone. Good morning. Okay. Hi, Vipin sir. Good morning.
Good morning all.
Ludia ma'am, hi, good morning. Anyway, the thing is that today we are going to start with a very interesting topic actually, right?
Yes.
Before that, I would like to introduce myself. My name is Christy and one of the trainers at AJINORAH Kochi.
Mm-hmm. My name is Varna and I'm one of the OET trainer at Kochi branch.
So we are here with yet another episode of amazing OET module, and today's module is speaking, as you know, and we are not going to speak today. We are just going to declutter the criteria,
Yes.
right? So for every modules there are some criteria.
Yes, exactly.
But for speaking, mainly there are two, and we are, as you can see in the thumbnail, there is no suspense on that. We are going to construct the how we can perform our speaking according to the clinical communication criteria. Am I right?
Yes, exactly. Because it is very mandatory to well known about the criteria. Then only students can lead their speaking in the better way.
You're very right. And I think more people are joining now.
Exactly.
So, good morning, everyone that have recently joined. Before moving to our session, I would like to tell you that a few things about AJINORAH. You know, every day during the last live also I already said that every day at AJINORAH we are starting a new initiatives or new openings or new vacancies for all of you. So this time what's happening is we are having a very good exciting news for nurses. First of all, that is HCA UK recruitment interview is coming up at Kochi. So HCA has a very wide opportunities for nurses these days, and as you know, HCA is having a very good opportunities and very good benefits than comparing to any other hospital situations at UK. So we are having a direct face-to-face client interview, so your chances of getting the offer letter at the time of interview is very high. So it's happening at 13th of March at our Kochi at Adimali itself. So if you are interested, then you can please contact our recruitment team. They will guide you. And one more thing is there, that is Deepika. As you know, Deepika is a very established press or a very established in area, and their 136th foundation anniversary is coming up. And the why we are excited is because our managing director, one and only managing director, Ajay sir, his full name is Mr. Ajay Matthew. He is getting a very big award, that is in the presence of our Honorable Chief Minister of Kerala, Mr. Sri Pinarayi Vijayan sir. Our Ajay sir, our managing director, Mr. Ajay Matthew, is getting a Business Excellence Award for his exemplary success in these days in business. So we want to tell you that, Ajay sir, we are so happy for you, and we know that we believe that you can achieve more and more success, and we all are behind you for all your successes. And one more thing is there, like during recently our last OET
Yeah.
results was published, and we have got a blasting success, and it was very amazing actually.
Yeah, exactly. It is with immense pleasure we are revealing that we do have a great result and with a lot of good grades. And that was a proud moment for AJINORAH, and we are really glad to announce it over here.
Yeah.
And that was an amazing result, right?
Yes, it was an amazing result. So I think we are over with those things. Please remember the HCA interview is the 13th of March, okay? Please save the date, okay?
Exactly. So the students are joining with us. They are waving their hands and wishing good morning. Good morning to everyone who are recently joined with us. And we are really happy to have you in this live. So not only that, that's, as Christy ma'am said, we're gonna deal with some kind of discussion over here.
Yeah.
It's not a speaking demo, but yeah, we do have a speaking demo with in between. But we're gonna discuss the criteria, and moreover that, if you have any queries, you can shoot up in the comment box. So we are really glad to answer that.
Yeah.
So everyone is saying hi and good morning all. Ashi, Maria, Ashwati, Gobiga, good morning.
So I think we can start, right?
Yeah, exactly.
So we are starting with the clinical communication criteria, right?
Right.
3 C's, no?
Yeah.
Clinical communication criteria. Actually, it's very easy, you know. We all are nurses and we know how to deal with the patients. So while caring for a patient in ill, while they are so ill they can't talk, means we'll be caring them more in person. We'll be using our senses like touch, everything for soothing them, right? For calming them.
Yeah, right.
But Vanna, what do you think? How we can calm them without using any touch or without seeing them face to face? Because OET speaking is all about voice modulation, all like that. But what do you think?
Christy ma'am, do you know one thing? The students are really struggling to bring voice modulation during the role play. And moreover that, this is not the topic, but it's really included in the criteria as well. I think if we are in the real life situation, if we are in the uniform itself, in the real life scenario or the real life emergency ward or hospital ward, we're gonna deal with the patient by accepting their emotions and accepting their concerns, right? So definitely there will be some kind of changes in our voice, right?
Exactly.
So what I said to my students always, you should adapt, or you should take your role play in the way it is and try to connect with your real life. So because we have been exposed to the old scenarios we are dealing with in the OET speaking.
Yeah.
So if you're taking that in your like with connecting to the natural situation, so you can easily take on the task without any kind of concerns.
Yeah.
Yeah. Then as we are going to discuss about the criterias, definitely we have to mention what are the criteria, right?
Exactly. So we were telling about clinical communication criteria, and like we said now, by using voices, it is very hard for tell or to get the idea that how calming we are to them, how empathetic we are to them. So one way that we can do that is to use some phrases or to use some words so that we can give an idea regarding that we are very caring for them or we are very calming for them, like that. So the criteria understood in this vast topic of clinical communication criteria are how many?
There are 5 in total.
Yes.
Yeah. So shall we discuss without any delay?
Yeah, of course.
Before moving to that, I just want to mention that the criteria is really divided or really separated into 2. The first one is linguistic criteria and the second one is clinical communication criteria. While we are discussing what the topic or which criteria we have to take for the live, we without any doubt we chosen the criteria that is clinical communication criteria.
Yes.
Because it's very easy to deal with the scores if you're taking the task in the better way or the right way. So in clinical communication criteria, the first one is none other than relationship building.
Yes.
Because we are talking to a patient, right? Or a bystander, that's third person would be. So it is very mandatory to deal a good relation with the patient
Yeah.
or whom you are talking with. And the second criteria is
Understanding and incorporating patient's perspective. There are a lot of things included in that. Anyway, we will declutter those things right now.
okay. And the third one is information gathering. Then the fourth one is information giving, and the last one,
Is providing structure.
right.
So these are the 5 criteria
Yeah.
that is included in the clinical communication criteria. Now we are going to take each one of that and we are going to discuss how we can properly do that. So as you know, each one of these criteria have a mark out of 3.
3. Yeah.
So it is very hard to score that 3, and I know that my students are very suffering, and sometimes even though they are getting good marks in the linguistic criteria, some ways, at some places they are losing their mark at clinical communication criteria.
Yeah, this in the examination or the interlocutor is clearly gonna tell you that it's just to assess your communication skill rather than your knowledge.
Exactly.
That's why the criteria is termed as clinical communication criteria, not as clinical knowledge assessment. Okay.
Exactly.
So it is. You have to communicate with the patient. I will use the term. You must communicate with the patient in the right way. Then only you can score good marks for the clinical communication criteria.
Yes.
So shall we discuss with that?
Yes. So
Okay.
shall I start with the relationship building?
Yeah, sure. Move on.
Okay. So the relationship building. See, the one thing that incorporated in relationship building is that we need to have a proper on-to-go communication throughout the 5 minutes with the patient. Okay. That's the first thing. So there are 4 sub-points inside the relationship building. First one is we have to greet the patient accordingly. Like we need to see them, look at them in a very pleasing way. We need to start in a very pleasing way. We need to very attentive. That's the first one, introduction. Second one is that we need to be very attentive towards the whole role play card. So how we can attentive?
Yeah. You can make an eye contact with the person you are talking with.
Yes. So as you can see now, I have asked her a question and she has responded to it, right?
Right.
That means she was attentive to me. That means if the patient asks a question or if the patient asks a concern, you need to reply to the question or to the concern. That's the job of the nurse. So that's how we will know that the nurse was attentive.
See, Christy, ma'am, my students, last day itself, one of the students asked me, ma'am, is this mandatory to make an eye contact with the interlocutor? So, what's your answer for that?
The primary my answer is that in OET, keeping an eye contact is not that much necessary because they haven't said anywhere they haven't said that keeping an eye contact is very necessary. But what I suggest is that, see, when I am talking to her or when I am talking to you guys, what would you feel if I'm always looking at down? What would you feel if I'm explaining, looking at down in my phone or looking at somewhere else? What would you feel? You will feel that I'm not being attentive, I'm not being listening to you. So it would be great if you could speak by looking at the interlocutor's face, but that's not upon the criteria. Okay, if you don't look, some students are having very much concern or very much they will be very much feared when they look into the interlocutor's face, right?
But if you're looking at them, it's gonna show that you're pretty much confident.
Yes.
And moreover that it is kind of attention seeking. If the interlocutor or the person whom you're talking with will give an attention over that if you're looking their eyes and talking with them.
Yeah, because just imagine that you might be the 10th or 20th speaking. You want them also to be very much included in your speaking also. So it would be great if you could look at their face sometimes at in between the role play, but it's not upon the criteria. If you don't look into your interlocutor's face also, it's okay, but it would be great. Okay.
Yeah, right.
So the first one I was telling about, the first one that I have already said about the attentiveness, and this is also a part of attentiveness. And the second one is the first one I forgot to explain the first one, that is introduction. So I'll just give an example, okay? While starting a role play, how would you feel like, good morning, my name is Christy and I'm from the registered nurse. How would you feel that? You would obviously, you will feel like I don't have any energy, I don't have any courtesy to speak to you. But how would you feel like, good morning, Mr. John, how are you feeling now? Well, my name is Christy, I'm one of the registered nurses working in this. See the energy difference, that energy matters a lot. See, by speaking without any energy and speaking with energy matters a lot. And it would be great if you could do with a very pleasant face also. See, some cases, if you are breaking a bad news, I would not suggest you to good morning, my name is Krista. I would not suggest you that, okay? But
up to the scenario, but probably
most of the cases
we have to begin your task in a pleasant
face,
because we are dealing with the concerns of the patient, right? But you are a nurse, right? You don't have any problems with that, so you can begin your introduction. You can approach the patient full on energy and full on the positive way or the pleasant way. There is no any big deal in that.
Of course. Anyway, I think that's clear now. Introduction, we need to start with a good introduction. One more thing is that I forgot to say that, just a minute. The thing is that we usually say what? Good morning, my name is so and so, I am the registered nurse working in this hospital, how may I help you? That's the usual cliche pattern that every student asks, isn't it, Vandana?
Right. And anyway, actually it's too boring to hear that continuously.
Everyone is saying that the same thing. But how would you feel like, good morning,
good morning,
please be seated.
Thank you.
Well, my name is Christy. Could you please tell me your name?
Yeah, sure. My name is Varna.
That's awesome. That's a good name. Anyway, that time the patient will also feel like he is being included in the speaking. I hope you got the point, right?
I think that it's really clarified right now.
Yes. So I am covered with the first subtopic and the second subtopic, the introduction and the attentiveness. Third subtopic is that non-judgmental. Okay, so just imagine you are not a smoker, I know that, but still just imagine you are a smoker here. And what will you feel like if I tell you how much you are a smoker, am I right? Or how many cigarettes you smoke a day?
See, nurse, I smoke 50 cigarettes per day. What's a big deal
in that? Oh
my
god, you smoke that much of cigarettes?
Yeah.
Please don't ask like this, okay? This is not an appropriate way. Like how I did is not an appropriate way of asking, okay? That's called being judgmental. We try to be non-judgmental, like we need to tell the patient in a very soothing way. That patient should not feel like he's doing a very big guilt, okay? So he should not feel guilty, he or she should not feel guilty on that. So how can I talk with her? So Varna, I know that you are smoking recently, and I think you are in my documentation, my papers, I can see that you're smoking around 15 cigarettes a day. So don't you think that that's somewhat harmful for your health?
See, nurse, I know that you're going the right way, but this is my habit and it's very hard to stop.
Yeah, I can understand. So Varna, what do you think? Did you feel any bad in my speaking now?
There is a dramatical difference with the first and second presentation, right?
Exactly. So I hope you got the point. If you have any doubt, just message me or just comment in the comment section, okay? Anyway, I think you got the point. Not only in the case of smoking, if the patient is obese, if the patient is alcoholic, if the patient is very reluctant, or if patient is not compliant towards the medications, please don't make them feel so guilty. Please approach them in a very calm or very pleasant way. Okay.
Exactly. I just want to add one more thing, that don't force the patient or the whom you are talking with. Don't force them to follow your instruction. There are some kind of words you should avoid in OET speaking. So shall I mention that too?
Of course.
Yeah, you can avoid. You should avoid should, have, must, or mandatory, because you can give a suggestion of other, it's also including non-judgmental statement. Okay, you can add some kind of words like it is better to, or it is very important to. Okay, that's also a way of non-judgment, right? Okay, I think that we are done with the first criteria, relationship building in a good way.
Yes.
So shall I go with the second criteria,
Of
Christina?
course.
Yeah, sure. So the second one is understanding and incorporating the patient perspective and concern. So from it's very clear that you have to understand and you have to take the concerns and perspective of patient in the way it is. Okay. In that there are some kind of subtopics or some sub criteria included. That is, we have to explore the ideas and we have to take on the concerns or the cues or the expectation. These are the things which are included in the second
Yes.
criteria. So for that is for listening the concern or we are understanding the concern, the first one you have to keep in mind that you should be a good listener. Okay, you have to listen what the patient is saying or what the concern of the patient. Then only you can give an appropriate answer or kind of reassurance. You can give to them in the right way. And one of the tips to deal with this criteria, you can paraphrase it or you can restate the sentence or the statement which the patient said.
Yeah.
Like exactly, one of the thing is, if you're saying that the patient is saying that, see nurse, I'm really concerned regarding my health condition. For me too, this is my first time that I'm experiencing so much abdominal pain. So
Yeah.
I'm really concerned regarding that.
I can really understand that you are having a very tough time during this abdominal pain. But one thing I can see that is you are very standing strong. I really appreciate you on that fact. So here what I did, I have restated her concern, I have reassured her.
Yeah.
So this is called restating and reassuring.
Reassuring.
Okay, so this matters a lot in our speaking. So what does this mean? This means that I was listening to her. That's why I could tell her that she has abdominal pain, and that also means that I reassured her on that fact. So this has a very good score in OET. Okay.
So you can also add in that in this criteria the thing what we are always given advice, add reassurance. So we
Yeah.
have to reassure the patient or the bystander or whom you are talking with. You have to give reassurance phrases right over this criteria. Okay, you can say that I can really sense your feeling, or I know that's very unfortunate you hear that, or it's very hard to hear that. You can take on the phrases and fix in the right way. Just listen them or listen the concern of the patient.
Yeah.
Okay.
Instead of saying I can really understand your concern, you can just restate it.
Yeah,
So
restate.
It means that you are being very attentive to them. So you will get a very good mark in the first criteria, that is relationship building, and also in this criteria also.
Christine ma'am, I do have a question for you. Is there anything that if the patient is not stating that some kind of things or some kind of concern, shall we assess with or shall we state that with the gestures or the expressions?
Actually, I didn't get the point. Can you just restate it?
Yeah, sure. I can restate it. Like, if the patient is showing some kind of worries in her or his face, shall we pick that hint?
Of course. That's why they are showing that worry. If I have made my forehead wrinkled. That's how she understood that I didn't got her point. Now, that's the first hint the interlocutor gives you. If they don't understand, obviously they will make it in their facial expression.
Exactly.
You can get that point. You can ask, your face looks very worried. What's going on? You can ask like that.
Yeah.
Okay.
Or you can say that from your facial expression, it is very clear that you are concerned about something. If you don't mind, may I know the reason, please?
Yes.
It's a very clear and the best way of presentation. That it doesn't mean that you are not listening the patient, you are observing the patient too.
Yeah.
So it's very attentive and it's gonna give some kind of attractive or impressive factors in your speaking too. I'm not telling to the impressive interlocutor, but it's the best way to you can also choose this method to deal with your OET speaking.
Exactly.
So
I think, ma'am, we have a concern in our YouTube. So, someone has asked during conversation, if we don't get what patient is saying, can we ask him again what he said?
Yeah.
So, of course, we can ask. See, if we don't get what the patient is saying, obviously we can ask,
As a
like, could you
patient.
please restate what you have said? I really apologize, I didn't get your point. Could you please tell me, like, how did I said her again last time? Could you please restate
State it,
Of
yeah.
course we can ask. Okay, we can't go it blindly. Of course we can ask.
I was into that point. I was noted it over there, but it is under the information gathering criteria. But I do have a statement for this. Shall I reveal it now?
Sure.
So that was a concern from one of my students. So I think that I can clarify it right over here. So if you are not clear with the statement what the interlocutor said, okay, what the interlocutor stated, you can go with like sorry, I couldn't quite catch you. If you don't mind, could you restate the thing what you have said before?
Of
Again,
course.
but you should make sure that you are asking the question in a calm and pleading way.
Yes.
Because it's something that wrong what happened in the conversation. Maybe you were not able to audible with him, or you are not understanding the words of him. So try. You can ask them like after apologizing or after placing a sorry prior.
Yeah.
Okay. Is that clear?
I think that's clear to them. So can we move to the next criteria? So
Yeah.
is that criteria over?
Yes, I think that we're done with the criteria in a better way. So, understanding patient concern is, or the perspective is really important to deal with the OET speaking. I just want to add on one more thing that
Yes.
before winding the second criteria. Okay, so what I said, what we have to add some kind of reassurance over here, right?
Yeah.
We have given some kind of notes or some kind. The students have learned by heart or some kind of reassurance. That's not only the reassurance statement. What Christy man just said before, or if the patient is saying that I do have pain, this is my first time of experience in the hospital, so you can say that as a patient nurse, if I'm saying dealing with that situation, I'm gonna say that see Sarah, your worries are really understandable. For you, this is the first time in the hospital, but it's a very mild condition. These sentences are also known as reassurance. Okay, that we are convincing or we are promising the patient your concerns are normal or your concerns are really valid.
Yes.
The statement what you are fixing it is also known as reassurance.
Yes, of course. I think that's clearly understandable to you. Anyway, next one is?
The next one, the third one is information gathering. So before moving to that, I just want to ask, how can we gather information from a person?
I think by asking questions, am I right?
Right, exactly. So we have to ask questions to the patient or the bystander to seek the information from their side, right? So there are different kind of questioning. The first one is open question and the second one is closed question.
Yes.
So do you have any idea regarding what open question is?
Actually, I was expecting her question. And of course, I have some. See, from the nursing itself, I think we all are nurses here. And from the nursing dates itself, we have heard like open-ended questions and closed-ended questions in the mental health.
Yeah, right.
Am I right? During our mental health assessment, there are some different question patterns. I think you are going in a nostalgic way.
Yeah, me too.
Yeah. Okay, come back to our OET. Okay, so open-ended questions always means that we are giving some space for the patient to talk. So she asked me, do I have any opinions regarding that? So if she asked me that do I have any idea, I could have just simply said yes or no. Okay, but as she has asked what is my opinion, that means that I have a very vast space to talk there, right?
Right.
So most of the questions with the WHO question, like what, who, how, then when, these type of questions is always considered as an open-ended questions.
Right.
But closed-ended questions just have two answers, either yes or no. So if I ask you, how do you feel?
I feel good.
So could you please explain how do you feel now?
I'm feeling pretty much good. I think I'm done all my activities in a normal way.
Yeah.
And seems to be very good way today.
Okay, so I have given her a space to talk here, and that's called as open-ended questions. But if I ask her, did you had your breakfast?
Yes.
That's all. What did you had?
It's bread.
That's all. So if I asked her what did you had, then she can explain. If I ask her did you had or something that is being closed, that means she can only answer with yes or no. That's the difference between closed-ended questions and open-ended questions.
So, Christy ma'am, before explaining the criteria, I do catch a question over here from Vipin Wilson. How can we ask the habit of habits? How can you ask the habits of patient? So, what's a big deal, or what's the best way to ask the habit of the patient? See, habit is a personal thing of the patient, right?
Yeah.
So, before asking any kind of personal question, you can seek a permission to ask, right?
Yes.
So, do you have any suggestion for that?
Yes. Simply going like, do you smoke? Do you take alcohol? Simply before going like that, you can
Directly
ask.
shooting the question is it's not the right way. You
Yeah.
can ask a permission. If you don't see Sarah, if you don't mind, may I ask you some personal questions, please?
Yes, because that, like she said, habit is completely a personal thing. If I has an habit, I have a habit, that means that it completely upon me. If that can be like I will be sharing with someone or I don't want to share with anyone. So always try to speak, always try to ask for their permission before moving to that habit thing.
Then you can directly ask. If you don't mind, could you tell me about your personal habits, or are you taking cigarettes or something, but very gentle and very pleading way.
So, or you can also ask like, do you have any habits of any smoking or any drinking like that? Also, you can ask after getting the permission. That will be more appropriate. Okay, so I think we have cleared that.
Speaking task, or is using
I think Stephen has asked, in speaking task there is using synonymous. So I didn't got the point what you're trying to convey us. It would be great if you could clear that question first, then we would like to clarify it. Okay, now we are moving to
the third criteria of clinical communication criteria, that is information giving. So information gathering. What Christy ma'am given brief points regarding the questions.
Yes.
Okay. So we are gathering, or we are seeking the information from the patient side. So at the moment we are speechless, right? As a nurse side, or as a nurse, don't interrupt in between. Okay, let the patient speak out. Don't interrupt the patient. Just be a good listener. The thing you have to kept in mind, that is to be as a good listener without any interruption.
Yes.
Okay. So at the time, what we can give as an assurance that we are listening them. We can use some kind of sounds over there, like that's exactly what we are doing right now.
Exactly.
That you can give some kind of sounds, or you can give a response like, okay, I see, okay, I'm noting it, something like that.
Yes, exactly.
It's so automatically it will be there if you are giving an attention to your listener.
So, Varna, I think I can give an example.
Yeah, sure.
During our nursing classes, if we get sleepy and we want to make the lecture things like we are very attentive, what we will do, we will take some notes, right?
Exactly.
Like that, we need to do the same setting. We need to make them understood. Like now, how she said, yeah, like that. We are saying no. Those words are being used to make them, or to make the interlocutor understand, or make the patient understand that we are hearing them or we are understanding them. Okay, so it will be better if you do that. Okay,
exactly. So there are some things to be kept in mind if you're dealing with the third criteria, that is information gathering. You should avoid compound question. So what mean by compound question? Compound question, that you are clubbing or you are asking 2 or 3 questions at a moment.
Yeah, exactly.
Okay, it's very bad to answer the question because we won't get any continuity. Even though if you ask, the patient have to speak for a long.
Okay,
so
I wanted to tell you, I was smiling when she was telling that, because
do you have an experience?
Exactly. See, students want to complete their task as soon as possible. So what they will do, they will ask like, could you please tell me regarding when was the onset, and how long was it, or what was the frequency, and did you tried any treatment? They will be shooting all these 3 questions together to us.
Because they were concerned about the task, there it's time
and
running.
also time also.
Yeah, exactly.
But the thing is that for an interlocutor, their task, the answers that for your question will be spreaded on either first or second or third task. So sometimes they won't tell you in a very only one and one answer itself. So if you could ask like, could you please tell me when it started? So they will give an answer. For the frequency, you can like, how long did it started, or how long did it stayed, or how frequent it is coming. Then on the third note, you can ask like, for final question, I would like to ask you that have you tried any treatment methods for this before? Like that you can ask. So that will be more appropriate. Don't ask all the questions in a one stretch, okay?
If it is given that customer said a statement or a task that onset frequency or something related to the condition itself, you can simply ask like, if the task or 7 or 8 bulletins to perform, that there is a time if challenging, if felt it, you can simply ask like, could you tell me regarding your condition in detail, please? And you should listen to interlocutor. Then there will be some kind of points missed by him or her, so we can pick up that and ask the question again.
Yes.
Okay. So what I mean by common question, that she said that don't ask a couple of questions. That moreover that it is very bad to hear that, could you tell me about the smoking habits and about your diet? It is two, right? Different statements. So ask the questions in a separate way, and avoid guiding question. Okay, it's not about the leading question what I said. Guiding question, you have an answer.
Okay.
Like you, for example, you stated you don't feel any kind of throbbing pain, right?
Yes.
So you can simply ask, are you feeling any kind of pain over the site?
Yes.
Because the patient have to answer it is whether it is a throbbing or some kind of pain. So don't ask any kind of guiding question over there.
Or you can ask like, have you noticed any change
Changes
of your
in your
symptoms,
symptoms.
or any change in your pain or the last night? You can also ask like that, okay?
And one of the questions like, so would you say you don't do any much exercises? Is that right way to ask?
No, I don't feel like
So
that.
you can simply ask, can you tell me regarding your exercise pattern, please?
That's more appropriate. I feel like I'm not being judged there.
Yeah, right.
If she asked the first way, if asked first way, I would have feel more embarrassed.
Yeah.
But the second way gives me a very vast idea to answer my point of view.
Okay, there is a question from our students. During preparation time, can we ask to convey the meaning of particular task that didn't understand? Okay.
Actually, Abhijit, my point on that is that you can't. They will not explain you a whole task, because it's our task. It's our job to find out what they are telling to convey. But one thing is that if you have any doubts regarding one particular word or a phrase, then you can ask that, because they know English. Of course, they will answer it. Okay, but
They are not from any kind of medical background, I think so. We are not pretty much sure regarding that. But they won't explain the task. Okay, if you have any concerns or if you are really confused regarding any kind of words, they're gonna give an explanation regarding the word. But they won't explain whether it is
finding
a
out
non-case.
what they mean in the task is our job. So they will not be giving that, and it would be better if you don't ask that also. But for a word and all, you can ask. Okay.
So there is one more question or query from Princey, that if it is a non-case, it is whether we need to introduce ourselves. Definitely we have to, because it's a non-case, right? What's the big deal if you could remind the patient that you are a nurse who gonna take care of him today also. Okay. So but for a non-case, probably take as a setting in the hospital ward, right?
Yeah.
So you know the patient, and the patient also knows you very well. So we can begin like, how can we begin the non-case in a better way?
Good morning.
Good morning.
As you already know, my name is Varna. My name is Christy, and hope you remember me. Anyway, I'm here for checking your vital signs. Like that also you can start. But one more thing I want to tell you, that is, sometimes the task will be just examine the cases, right?
Right.
During that time, please don't introduce yourself. Just imagine you have received a patient in your ward or in your ED, and they have came, have collected all the history, and before the doctor is coming, you made that patient go to a assessment. During the assessment or after the assessment, how would you feel like?
Again,
how would you
introducing
feel?
yourself, it's
Yes.
a bad way.
it will not give a good idea to the patient. See, the patient will feel like they have been not attentive towards them. So please don't introduce yourself in a just examined cases, but for non cases other than this, you can introduce yourself. Okay.
Right. So one more query from Shruti, right? If we didn't get time to complete the task, it may affect scoring.
So Shruti, I really understand what you are asking. The thing is that sometimes we don't know how OET didn't give us how they are assessing our speech. Am I right?
Exactly.
So we don't know whether they will give mark according to if we didn't complete it, but it is our task to complete. That's a criteria. We need to complete our task. So it will be always great if you could complete, but always remember, you need to please don't do hurry-burry. What will you do? What will happen if you hurry-burry? You will lose the first point, and also if you complete it also, or if you don't complete also, you will lose that task from your hand. But if you do in a very organized way, in a very concise way, it will give a very good impression to them. So what I suggest is, you need to complete the task, but if you don't complete also, please try to do in a very good manner. Okay.
I think for in between 5 of tasks, you are just able to complete the 4 only in the 5 minutes of time. It's fine if you're doing in the perfect way, that you have followed all the criteria in the better way. I think that you're gonna get the score, but we don't have an assurance regarding that. But we are telling the students it's totally fine, that what Christy man said, don't be so rushed and mess your all tasks to complete it. It gonna completely ruin your task or the way of your presentation. So be cool and take the task in the right way, and try to enact or try to ask the questions to the patient if we are talking to a real patient.
Yes.
So I think we done with the query, right?
Yeah, we can see a lot of queries are coming again, but we'll come back to the queries after this. Okay.
Yeah, sure.
So we are going to the next criteria. Am I right?
Right. Before moving to that, I just want to add on one more point in information gathering. It is better to summarize the content or summarize the topic that you discussed in the OET speaking, because there are some kind of tasks only having 3 bulletins to perform, so the time is kind of challenging. You're gonna done your task in 3 or 4 minutes. So in that sense, or in that scenario, you can restate or you can summarize the topic you have discussed.
Yes.
Or you can ask the patient that, or you can give some kind of statement or some kind of sentence that you have noticed in the task. So it's gonna give a confidence, or it's gonna give a reassurance that you listen the patient, or you were so attentive in the conversation.
Yeah.
Okay. So I think that we are done with the third criteria, information gathering, and the next one is
information giving.
So
all the task that is being incorporated in our role play card has this point of information giving. So whatever task we are doing is coming under this information giving. So what do you want to tell about that? So is there anything that we need to know before going to that?
Yeah, sure. We have to keep in mind that it's information giving, right? That we are performing our task, or we are giving some points that maybe or not the patient may know prior. So it is better to seek an information from patient side. We can just ask a question prior to the statement or prior to the explanation, because it is better to know whether patient know about that before you are explaining. So you can simply ask, can you tell me your knowledge, or can you tell me what you know about the something like any treatment plan or the condition. So you will get some kind of points the patient knows, or you will get that patient is not known about that. So then take on that, give a response for that question or the answer of the patient, then take on your task, then give a brief explanation regarding that, and make sure that after your explanation just get clarified that your points was clear. with that. Just is my point is clear, or am I clear with that? Are you following me? Some kind of things, some kind of questions over there. So information giving, simply if you're stating that it's all about your task.
Yes.
Simply it's all about your task. There are some kind of questions to be asked, there are some kind of statement you have to state, or there are something you have to reassure, suggest, or advises. It's all about your task, that is information giving.
Yes.
Okay, so in information giving, I just want to add on something, that using the process in the right way. So do you want to add something regarding that?
Of course. So what do we mean by having pauses? See, I'm pausing here means I'm collecting the next word to say, right?
Right.
So if you use a lot of pauses in your role play card, it will not give a good impression. So by saying like that, what will you feel like? I'm not being fluent in English.
Exactly.
And I don't know what to speak next. Am I right?
Right.
So in between of that, you can ask like, by the way, by the by, well, obviously, to be frank, honestly, how I got your point, like that. Also you can ask some of the phrases.
Yeah.
Okay, so if you add those phrases, it will not cut down your marks. It will add more marks to you only, because
It's a good way of presentation too.
exactly.
Don't be so paused, just showing that you're searching for words. You can add on the words or the phrases what Christy ma'am said, like well, or something. Just fill your space, or fill your blank space or sentence with certain words to be impressive or to construct a sentence.
Yeah. See, what happens in this process is like that we will be humming, right?
Exactly.
And that humming is not at all a good thing for me. Okay, so please cover that. We are covering that pause with that humming, but the humming is already giving you a negative score. But so you can add on these words to avoid that. Okay.
And also, and if you have to explain a long thing about a treatment plan, sometimes we have to perform the pre-operative procedures, right? There will be 4 or 5 steps to be explained. So don't be so rush. Okay. So give certain pauses over there.
Yeah.
Okay, you have to give certain pauses in between the sentence. Or if there is a full stop, give a pause. Okay, if there is a comma in the sentence, I'm saying that don't be so rash to construct a sentence. You have to make sure that you are speaking very naturally and the fluency is perfect in your the presentation, right?
Yes.
Okay, so about the next thing, what I just want to mention is encouraging reactions and feelings, right?
Yes.
So encouraging, what we have to encourage them? Just give a space, that right? We are speaking in between. That is information giving. That we are performing the task, totally fine. But in between, if the patient is having any concern, or the patient is not understanding our words, just make sure that the patient you're clarifying the queries of the patient in between.
Yes.
Right? So then what is the next is checking understanding. So in OET we are giving some notes, right, for our students in the booster class or some class. We are giving some kind of notes regarding the reassurance and follow-up question. So information giving, what I said, that it is better to ask a question prior and also after the explanation, right? So the question that you are asking after your explanation or in between your explanation is called as follow-up question.
Yes.
Okay, it is mandatory to ask a question because we are explaining something that patient is not known. So it is better to ask that whether you are understanding it or not, right?
Yes. So if you know that while taking these classes for you, we are asking like, are you getting us point, or did you got it? And you will give us the reply through these comments in this comment section. Now, if you don't give us a reply, if you don't ask like how how you can tell us, right? So in the OET speaking also the same thing. You need to ask whether the patient has understood whatever you have said, or whether they have simply heard you. So it's better to ask like, have you got my point? Do you understand it? You can simply ask like that. Or you are also asking, our students are also asking like, are you following? Are we on the same page? Like that also you can ask. Okay.
Right. And also just make sure that checking patients required knowledge. So what are the things what patient have to be known, or is the patient really want to know about something? That's like the best way to, you can ask the patient in between, do you have any more concerns, or do you have any queries, or do you really want anything to be clarified from my side?
Yes.
So these are the things what we are stating over. We are asking the patient that just seek an information, or just make a permission, or just ask the patient that if you really want to know about something, just ask it.
Yes.
Okay. So it's all about information giving. Then only we can give an explanation regarding what they really want to be, right?
Yeah.
So the final one, I think that I done with information giving in the good way. So we'll go with the queries of the students. Mother and child cases. Child is not present. We are talking to mothers, so we will ask mother's name only. So previously, or we were asking the both mothers and child's name, but now we are following the method. We are just asking the name of the mother. I always say to my student in my class, just ask the name of the person whom you are talking with. Whether it could be the bystander, it could be the mother or the father or the third person. Just ask the name of the person whom you are talking with, and you can mention the second one, or the patient or the child, as child itself.
Yeah.
Sarah, your child. Okay.
Yeah, you can say like that also. But one more thing is that if you ask the name of the child also, there is no problem.
There is no problem.
So if the thing is that if you need to say repeatedly like patient or your mother or your child in between your task, if you're planning to tell that repeatedly, so we would suggest that please don't repeatedly say like patient, child, your mother, your child. Instead of that, you can tell their name if you are planning to speak it repeatedly. But if you're not saying it that repeatedly, then you can simply ask the name of the mother. So being in a safe zone, you can ask the
because
name of both.
Definitely you won't be too much confident. Yeah, you should be confident you're speaking. You're gonna mix the names, or you're gonna forget one name, otherwise you're gonna misplace the name. Exact word is misplacing. Yeah, instead of patient's name, you're gonna fix the name of mother. So for avoiding that confusion, we are saying that just ask the name of the person whom you are talking with. It's totally fine if you're confident to deal with the task in a better way. You can ask both the mother and the child's name.
Yeah.
I think that I done with the query.
Yes.
So shall we move to the last
Yes,
criteria?
Yeah.
That is providing structure. So it's from providing structure, maybe they're gonna know it's what structure exactly. And the students is well known that there are some kind of tasks. For in number, it's 4 or 6 or 7. So you must follow the task in one by one way, or the way it is given. There should not be any compromise in your organization. And it's all about the structure. Maybe sometimes the students gonna ask the fourth, gonna perform the fourth task, then third task, then second one. It's not the right way to deal with your OT speaking, because it's a scenario, right? It's a setting, and there will be some kind of criteria to be followed. You have to follow the task one by one. Then only there will be an continuity for your task.
Yes. So one more doubt is there, like if a patient came to the emergency with heavy bleeding in emergency situation, whether we have to introduce ourselves. So see, those type of situation will not come. First thing. Second thing, if you come also, for if we whenever we are getting a patient, it means that we need to just tell our name. That's the first and basic rule in all the nursing procedures, in all the nursing care. So simply at that time, see, the patient is being heavily bleeding, you can't say like my name is Christy, good morning,
Exactly.
and I'm the one of the registered nurses. You can't say like that. Obviously,
Don't-
we
don't-
know that.
Don't sing a song over there.
Yes, you
Just concise.
yes, you can simply tell like, my name is Christy. I will be taking care of you. So tell me, what did happen? How do you feel now? Like that, you can ask. Okay, so I think that's cleared. And Liju has asked if the name already given in the role play card, is it necessary to ask name during
No.
preparation time? So see, if the name is already given, that means the interlocutor also knows the name. You can simply go on with the task. No problem is there. But sometimes there can be a chance that there can be a miscommunication with the role play cards, or you and the interlocutor. For that, you can confirm the name. So sir, you would like to be called as this, as mentioned in the role play card, am I right? Like that also you can ask, and you can go ahead with the task. So it's not mandatory, as you have already know the name, but for being confirmed, you can ask, for my confirmation, this is your name, am I right? This is your name as given in the role play card, am I right? Like that you can ask. Okay.
Okay, so Arya is asking that if you didn't hear it, the statement what the interlocutor said, can we ask it again? That we already discussed about
Yes.
that. You can really ask about that, but you can ask. The way of your presentation should be in a good way.
Yes.
That very sorry, Sarah. What you have said was not much understood. So could you explain that again for me?
Yes.
So something that should be a please or sorry should be added in that, because it's our mistake that we couldn't catch that. So you can ask it, totally fine with that, but the presentation should be in a better way.
Okay, one more thing. Ashwini has asked, we cannot use the word patient in speaking session, right? Actually, I agree with Ashwini.
Right.
It would
Me
be
too.
great if you could avoid the word patient. Okay, instead of patient, that's what I said in the earlier time. It would be great if you could ask, if you could tell their name instead of patient, or your child or your mother. Instead of that, you can tell their name.
Christy ma'am, in the some scenario that if we are talking to the bystander, there will be given that we are talking to the bystander, right? So
Yes.
the patient, definitely the students gonna mention that's patient.
Yes.
So don't be so confused in that. It is clearly given whether the mother or the father or the relation of the particular person will be given in the scenario.
Yes.
So you can mention that your mother, Sarah, your mother, or John, your father. So
Yes.
you can mention that. It's better to avoid the word patient,
Yes.
because no one likes to hear that.
Yes.
So,
Okay, I think that's clear. Now, can we move further?
yeah, sure. I just want to mention some kind of signposting and linking phrases in this providing structure, because if it is given what I said, that if we are dealing with some kind of procedures or some kind of assessment, there will be something followed by one, 2, 3, 4 steps, right?
Yeah, yeah.
So in between, how can we construct a sentence? You can just begin like, firstly, we're gonna do this, then finally. So 3 words are fixed in first, second, and third or fourth, right? So in that way, you can construct that, or you can simply start like, let me explain. I would like to explain again, or now we're gonna discuss, or something. Or this is because, so that. There are some kind of phrases you can fix in between the sentence to get a continuity.
Yes.
It's all about connection and the continuation of your task. That's all about the providing structure.
Yes.
It's a very simple way, but most of them won't face too much hard to deal with.
Yeah.
Right?
Yes.
It's a simple criteria. You can simply score 3 out of 3.
Yeah.
Before, I think that we are done with all five criteria,
Yes.
right?
Yes.
Till now, we just discussed about what clinical communication criteria, right? So simply, I just want to underline one thing, that we are communicating with a patient or the bystander in a clinical setting. Okay, so all these criteria simply can be performed if you're following one method. Do you have any idea regarding that?
No. Will you explain that?
Yeah, sure. With full of happiness, I'm gonna explain that, because it's a clinical setting, right?
Yes.
What was our first criteria? Well, the first one is relationship building, right? So if you are maintaining a good relation with the patient, what means that exactly? That is simply we are asking question, we are answering their question, and we are giving certain statements.
Yes.
So if you're maintaining a good relationship, if it is a real life situation, you're gonna listen them, right?
Okay.
You're gonna forget about the task, you're gonna forget about the time. Just try to build a good relation, just listen them, just give a response to their task
Okay.
or their question. So simply you can easily deal with your all rest of the criteria, because if you're talking with a patient or if you're maintaining a relationship in between, what exactly we are doing here, we are gonna ask question, that is information gathering. We're gonna give some kind of explanation, that is information giving.
Yes.
And we are listening their concerns or queries, that is the second criteria, understanding the concern of the patient, right?
Yeah.
Then all these are followed by one. It is providing structure.
Okay.
So the simple way, just make sure that you're doing a good relation, you are making a good relation with the patient or the bystander whom you are talking with.
Okay.
You're gonna easily deal with all the criteria without any struggle.
Okay.
Is that clear?
Yes, that's absolutely clear.
So
Now, can we show them how to do that effectively?
Yeah, sure.
All those things that we said now.
yeah, sure, we can deal with that. So here we won't perform as a role play. We're gonna give some kind of statements,
Yes.
and we're gonna show how you're gonna perform, or we're gonna point out what the things we are explained.
Yes.
So shall we move with that?
Yeah.
Mm-hmm.
So can we have the slide? Okay, so here we have the slide. I think you have already taken a look in this. Now, so Vanna, who is
Yeah.
going to play the role, the toughest question, who is going to play the role of a nurse?
Without any doubts, I will play the role of patient.
Okay, okay, fine. Now I'll be playing the role of a nurse. Now, here, like she said earlier, we are not going to do the whole role play. We are just going to state a few of ideas. Only that's going to happen now. Okay.
So would we give a 3-minute time for the students, or shall we start with it?
Shall we start?
Yeah, sure.
Because they have been waiting for so long.
Yeah, sure.
I think
So-
we will go with that, right?
Okay, without any delay, we're gonna discuss or we're gonna fix the points we discussed till now.
Yes.
Okay. So, yeah, let's begin.
Okay, so you see a 65-year-old patient. I'll give you an idea regarding what is going on. There is a clinic, and the patient is coming to the clinic by for attending for checking his anemia, whether he has an anemia. For that, we need to draw the blood, okay, for a blood test. And but the patient is very worried that whether the nurse will get appropriate vein, and whether she will get the blood in the first prick itself, because the patient don't want to suffer anymore. Now the nurse needs to reassure the patient and to give the reasons why that the blood, sometimes the blood is not being drawn, why that is occurring. We need to tell the patient. Okay, that's the whole task. Okay, that's the whole idea behind the task. Now we are just going to start in between. Okay,
Yeah, sure.
one more thing, we are not going to do the whole role play, we are just stating you, so just listen keenly to us. That's the whole one thing that is needed right now. Okay.
So, shall we start?
Yes. So good morning.
Good morning, nurse.
Please be seated.
Thank you.
So my name is Christy. I'm one of the registered nurse in this clinic. So for my documentation, would you please tell me your name?
Yeah, sure. My name is Varna.
So Vanna, that's a very good name, but your name is good, but your face looks so worried. What's going on?
See, nurse, I feel so tired and bit concerned in my condition right now, because I do have a doubt that I'm dealing with some kind of anemia, and
Okay.
Moreover that I'm really scared of this blood test, or that's the more concerning thing right in
So
me.
you're here for blood test for anemia, am I right?
Right, nurse.
Okay, so you're worried regarding that whether I will get a blood in your first prick itself, am I right?
Right, nurse.
I can really sense that you're very, 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 very worried in your facial expression itself. But see, how do you know that you have got this anemia? Because you already said me that you are here for anemia, right?
Right, nurse. That was my assumption actually, because I feel so tired and I'm not feeling so well. So I just concerned or just have a doubt that whether I could have anemia or not.
Okay, so what I would like to tell you that is, it's first of all, it's not my role to tell you whether that is anemia or not.
Okay.
Second thing is that unless we get a blood test results, we cannot confirm that what is going on, what is the condition you have right now. Okay, so we'll wait for till the blood test to come. And do you have any more concerns other than this?
Yes, I do have a concern that I had a blood test before.
Okay.
That was so painful. The nurse had difficulty in finding vein from my arms.
Okay.
So I'm really worried whether it's gonna happen again.
Okay, so see, Varna, I can really sense that you are having that painful experience from the past blood drawing. See, to be saying frankly, it's a very common concern actually, but the thing is that I have been here for a very long time, and I have been getting a lot of patients all the way in my career, and I can really assure you that you will not be feeling that much of pain this time. And one more thing is that the reason why they haven't got your pain is because might be because of the dehydration that you're facing, or because of the low blood pressure that you're having. So maybe those can be the reasons, but anyway, we will be optimistic this time, and I'm really sure that I will get it. So before moving to that, may I please enlist what we are going to do in this task or in this procedure?
Yeah, sure, nurse. You can proceed with that then.
Okay, first of all, I will just check in which arm, in the left arm or in the right arm, which arm you are getting more blood right now. Then we will use the vein in the upper arm, mostly in the hand, in the upper arm itself. So you will feel less pain. Anyway, while moving to that, your blood test results will come in just 2 to 3 weeks, and it will be directly sent to the doctor, and you can really go to the follow-up appointment. Did you got my point on that?
Yes, I got for that, so I have to wait for the result, right?
Yes, you need to wait for some time.
Yeah, sure, that's totally fine. I just want to make sure that it's not painful.
Of course, I can really sense that you are being very much worried regarding the pain that you have already felt, but I can really tell you that you will not feel that much of pain this time. Please be optimistic towards that. And there are some procedures behind this. Would you like to hear that?
Yeah, sure, I can.
Yeah, thank you. For after I draw your blood, your sample will be sent to the laboratory for analysis, and the data will be sent to a doctor, and that after that you can simply go to the doctor's office for getting the diagnosis.
Yeah, sure.
So I hope you got that.
It's pretty much clear right now.
So I think you are calm down right now, and you are okay with that right now.
I'm totally fine with that.
Yeah, so can I proceed with the blood being drawn?
Yeah, sure, you can proceed with the procedure right now.
Thank you so much. So this is the end of our role play. So see, we have started in a very good pleasant way, and we have asked the follow-up questions in between, and we have got in a very structured way. We have asked the open-ended questions. This is the very beautiful method how you can do a role play
in the good way.
Anyway, we have said like we are not doing a role play, but still we have
done it.
We have done all the things in that. I think you all have got an idea regarding that. Am I right?
Right.
If you have any doubts, you can just ask us in the comment section.
What I felt was really good in the role play. Christina was listening to me, and she was picking the concerns, or she was picking the hints. What she said from the facial expression, it is clear that I'm really worried. Okay. So you can it was so comfortable for the patient to listen that, and it will give an affection with the conversation, because the patient will listen to your words.
Yes.
So that was really good in your presentation.
Yeah.
So that was a discussion about.
Yes.
Yeah, do
So
we
I
have
think we are at
anything?
the end of our session. Anyway, if you have any queries, any more queries, you can just simply ask. Okay. Now, Gracelyn has asked, could you please give an introduction for non-case and unknown case in hospital ward? So in a hospital ward for a non-case, you can simply tell like, see, both of this starts like good morning, same like that. Second one is that in an unknown cases, you can ask the patient's name, and also you can introduce yourself. For an unknown case, you can simply state your name and you can say, good morning, my name is Christy, I'm and the attending nurse working in this hospital. How do you feel now? There you are not asking for the patient's name because it will become an unknown case, obviously.
You're right.
Otherwise everything is like
So
the
you can
same.
simply ask for the documentation purpose. May I know the name, please?
Yes.
Okay.
And Arya has asked if we didn't heard what patient told, is that okay to ask them
That we done
to
with
tell
it,
again? I think we have already met with that concern earlier. Yes, you can tell that. You can ask the interlocutor what they have told. You can tell them to restate it. Okay.
And
I
is there
think
anything?
we don't have, our students don't have any other doubts. If you have any doubts, you can simply put it in the comment section. Okay, I think it's clear for them. So we really thank you all for listening to us this till now, and we
I
are
feel so happy that students have stated a very genuine question in the
Yes,
comment box.
yes.
So I feel so fullness, but we feel so fullness to be to give a clarification regarding your doubts.
Yes. So we are so happy. See, speaking is a very vast topic, and speaking doesn't have any boundaries. We can speak to the patient or to the interlocutor till how we feel appropriate. Okay. So
Right.
there is no boundaries there, and it's a very super task after like super module to get to score a
Correct.
good marks.
Yeah.
Okay. So we thank you all from the bottom of our heart, and we thank you all the students, all the viewers, and the team behind this live. They were very helpful.
Supportive and attentive.
Yes, we thank all of the crew in the AJINORAH and also all the viewers, and please stay tuned for all the updates, and we'll be coming back with lots of interesting sessions. Okay.
Yes, sir. Shall
Till
we
the time-
wind up there?
Yes. So, and we this week an exam is coming up, and we tell all our students all the best, and do well for your exams. You have come across this far working hard. Now you can achieve this goal, and we are very sure about that. Please be calm and please be confident. Okay.
So, Christy ma'am, we do have one more question, that if the time remains, how can we drag after? So we can, if the time is remaining, you can simply summarize or restate the sentence or the statement you have said. So after that summarization, just ask a question for any queries, then wind up the task.
Yes. So Shruti has asked if the patient is too much handle or too much reluctant, how we can handle the situation. So Shruti, we are not from a lot of time we are not getting the reluctant patient. If they are reluctant also, please don't worry, you will get good marks. Okay, don't worry on that. Please be nice to them. Please don't get
Don't
angry.
be so panic if the patient is reluctant. Okay, as a nurse, you're gonna deal with some kind of reluctant patient
Yes.
in the hospital itself. So try to be so calm and try to make the patient comfortable, and try to make sure that you're presenting your task in a pleading way or in
Yes.
the empathetic way. That's
Yes.
totally fine. If the patient is reluctant or if the patient is not taking your points in a good sense, that's
Yeah.
totally fine. Okay.
Okay, I think that's clear till there. Okay, we thank you everyone
Everyone.
again. Okay, bye. We'll see you in the next live. Bye.
Wish you a good day all.